Hello, my name is Taarika Hedge, and I will be a senior at Strongsville High School this fall. This summer, I worked in the respiratory department at Lutheran Hospital as a respiratory therapy intern. The title of my project was a comparison of standard nebulizer and breath-actuated nebulizer treatment in relation to patient length of stay. A nebulizer is a device used to provide liquid medication, usually in the form of bronchodilator treatment, to the lungs in the form of a mist. A bronchodilator is a medication used to expand airflow to the lungs and is often prescribed to patients with COPD and asthmatic conditions. Prior to this study, all patients ordered bronchodilator treatment at Lutheran Hospital were administered standard nebulizers. The main objective of this study was to determine if the breath-actuated nebulizer had an effect on shortening the length of stay of patients admitted to the hospital. A standard nebulizer is a device that continuously supplies aerosolized medication to the lungs during both inhalation and exhalation. A breath-actuated nebulizer is a device that supplies aerosolized medication to the lungs every time the patient inhales, implying a deeper deposition of the bronchodilator medication in the lungs and heightening its effectiveness. We hypothesized that patients who received the band would have a shorter length of stay than patients who received the conventional standard nebulizer. This study reviewed 55 patients, 36 of whom were administered standard nebulizer treatment, and 19 of whom received band treatment from May 2011 to July 2011. The diagnosis criteria for the patient population was COPD and asthma, pneumonia, and a non-respiratory primary diagnosis with secondary breathing distress. Data was collected using MyPractice Epic database. The data collected included the following information: gender, age, primary diagnosis, secondary diagnosis, attending physician, heart rate, respiratory rate, O2 saturation level, type of bronchodilator medication, doses and frequency of the medication, length of stay, and the nebulizer used. Out of 36 patients administered standard treatment, 13 were male and 23 were female. Out of the 19 patients administered band treatment, 7 were male and 12 were female. The largest percentage of patients were between the ages of 51 and 80. The chart to the left also indicates a similar distribution among age levels for both nebulizer populations. The largest percentage of patients from both nebulizer populations had a primary diagnosis of COPD. The primary diagnosis characteristics, as shown in the chart, also had a similar distribution between both nebulizer populations. The length of stay, calculated as the number of days from the patient's admit date to the patient's discharge date, is shown in the chart for the two nebulizer populations. The length of stay data for both nebulizers could be fit with normal distributions. The band had a shorter mean length of stay compared to the standard nebulizer data as shown in the chart. The standard nebulizer's mean length of stay was 4.83 days, while the band's mean length of stay was 3.26 days. In each diagnosis category, patients given band treatment had a shorter length of stay than those given standard nebulizer treatment as shown in the chart. The difference in average length of stay varied between approximately 1 day to 3 days depending on the diagnosis criteria. The t-test was applied to the standard nebulizer and band data sets with the null hypothesis that the average length of stay for each set is the same. Due to the limited amount of data, no distinction was made based upon the diagnosis criteria. The variances of the two data sets were assumed to be the same. This table presents the results of this test applied at the 95th% confidence level. Since the p-value is less than 0.05, the null hypothesis is rejected at the 95th% confidence level. This is also confirmed by the 95th% confidence interval for the difference in length of stay, since the interval does not contain 0. As you can see, the t-statistic value was 2.459, the p-value was 0.0172, and the 95th% confidence interval for difference in length of stay was 0.2896 to 2.8508 days. In conclusion, the results showed that treatment with band led to a statistically significant reduction. The mean reduction was 1.5 days in hospital length of stay compared to that of the standard nebulizer. Although the data suggests a decrease in length of stay for each individual diagnosis, the amount of data was insufficient in providing statistical support for this. These findings are consistent with studies at Baylor University, Medical Center at Dallas and Christiana Care Healthcare System, both of which concluded that band considerably shortened the length of stay for admitted patients as compared to standard nebulizers. The recommendations would be to extend the study to a greater number of patients who meet the diagnosis criteria in order to acquire more data for the study. Also, it would be recommended to study the O2 saturation, respiratory rate, and heart rate of patients in a more detailed manner, as well as to investigate the financial advantages of using BAN. Here are the references for the study. And I would like to acknowledge and thank my mentor, Chris Schwanenberger, my co-mentor, William Rogers, the Respiratory Therapy Department at Lutheran Hospital, my peer mentor, Stetson Thacker, my fellow interns, and the Office of Civic Education Initiatives for this opportunity. Thank you.